Kim Fenter. This is going to be really exciting because I feel like the past couple of weeks I've just been talking about you, and then I keep saying to people, and once you hear my interview with Kim, I promise you'll have all the secrets and you'll know how it works. So thanks for taking some time out with me on a summer Friday.
Oh, thank you very much. I'm really happy to be here.
This is awesome that we'll get to capture this because it's so many things that I do feel like I use you as a case study without having this interview. So it's going to be fantastic to have it. I know that you are a health coach inside of a women's health center, obstetrics and gynecology. You're a certified, oh my gosh, you just told me, certified naturopathic doctor of naturopathy. And you are an amazing TLS coach and educator. And just by looking at the display you have behind you, I mean, I've been there, you're like, you need this and you need this. And you are, nutraMetrix extraordinaire in just being so well versed on products and, everything. But tell me a little bit about like your health coach training and how you kind of met up with your women's health clinic to make that partnership work together.
Well, it's a really interesting story because my background, my real true background out of college, what I call before children or BC, was in retail. So I had a really great friendship relationship, one with one of my senior partners who was a business owner, and I worked with her. I was introduced, and I'm going to say her name, Lynn Briand. I'm going to give her a little bit of kudos here. But she introduced me to the nutraMetrix line. And at first I was very resistant to looking at the nutraMetrix line because I wasn't exactly sure what it was all about. And, thankfully, Lynn was very persistent and had the confidence in me through working with me to really be very persistent in talking to me about the nutraMetrix line and what it would do as far as value to my clients. After being a buyer for a department store, having a really strong retail background, I didn't want to be in the retail background anymore. I didn't want to be in the retail stores. I did not want to be working for a durable medical equipment company. That's where I started looking into my passion, which is health and creating health within the people I come in contact with. And that kind of brought me into my gynecologist's office, where they were looking for someone. And I always say it was the right place, the right time, talking the right language to the right people. They really wanted to bring me in as beginning as a NAC, or what we used to call a NAC, what we now call an NC. And that's where it just blossomed from there. That was 12 years ago. And from 12 years, then I became, just from working as an NC in the practice, then it evolved into becoming a practitioner or a provider of the practice. So, and that dynamic has worked really well because there was a little bit of resistance at the beginning in regards to bringing product into a practice. And once they understood the dynamic of creating relationships with patients, with clients, and understanding their background, understanding where the practitioner is coming from, understanding where the actual patient or client is coming from, creating a well-rounded, whether it be with weight loss, whether it would be with supplementation, whether it be just mindset, creating what is a better outcome for those patients and client.
I feel like you and I have worked together for maybe about 5 years almost. And I can even see that your office has come a long way. Your office reminds me a lot of my dad's practice, very traditional. I mean, this is not the type of office that, you would expect to necessarily have, your little corner. You have an office that's right next to the front door. It's right across from the check-in desk. It's, there's a little bit of branding and things you've put around, but it still is like your traditional, I mean, outside of this, I wish they could see, you know, that the rest of the office doesn't look like your little corner of the world right here.
Very
and
true.
and I know that you've done a lot with educating the staff, getting the staff on products themselves, making sure, I mean, you still as an NC follow the implementation plan so well, because now you're wearing two hats. Now you're a provider within the office as well as still being the NC. So I know that's always, you know, a tipping point, because they're like, just send me your patients. How many providers are in your office other than you? How many other
There
ones?
are 13 providers in our office, plus we have 2 mental health specialists. We have 2 people who work with our mental health area. And it is truly training staff, training providers about how supplementation can better improve the health of their patients, even in the mental health industry. So yeah, when you walk outside of my office, there really isn't a lot of branding other than in our waiting room. There's a banner that actually says who I am, what I do. But other than that, it's me speaking to the providers speaking to the patients. And at this point in time, my ratio of patients coming from within the practice being referred to me by those 13 providers and 2 mental health counselors, I have a 50-50 ratio. It is now other providers outside of our practice, they're referring their patients to me as well.
Which probably has helped also grow the practice. I mean, it's that you're so different there. I have this thing, it's called the threshold rule. Once you can get someone over the threshold the first time, they're more likely to come back over the threshold again, because they're familiar. And our brain likes to keep us safe, and it likes to use the least amount of energy. So even just navigating a new parking lot, knowing where the front door is, where the desk is located, if you've done it once, it takes a lot less brain power and energy to do it again. I mean, this is why we'll move an hour away and drive an hour to go to the same hairdresser, or drive an hour to go back to the same gynecologist. Because it's like, I can't think of one more thing. I can't do anything else that's new. I need to just go back to my old habits. It's our reptilian brain.
Sure. It is.
And so it's so huge. If you can get someone in for something else, you're going to just build it all together. I'm going off script here, Kim. I'm so sorry. I had to prep all this, but I have more questions. So, so you worked with your own office that you knew. Did they come in as a group, or did one provider open an account? And out of the 13, how many of them have accounts?
We had 2 providers come in. Actually, I take that back. One provider came in as the account holder for the establishment, and we're private practice. We are not we're not general. We are definitely private practice. So one of the owners, and then she brought in a second owner. So of those 13, really only 2 are partners within nutraMetrix.
Which I just want to point out to everyone, like, it doesn't mean that you still don't generate volume from everyone else. I bet a lot of them are also users of the products. I bet staff are users of the product. And so a lot of people think that it has to come in as the health clinic in general, or everyone has to be on board. I've found the same thing, Kim, that you don't need that. Like, and the education, it's not just that you register the account, like there has to be this ongoing campaign and education. And as we come out with new products and as things change, got to keep educating. So you had said to me at one point that every new OB gets scheduled automatically with you. Is that something that's still happening?
It is still happening. We've really, providers, management, administrative, everyone feels the importance of nutrition during pregnancy. So that is, originally we had them, their first new OB appointment, they were scheduled with me as well. Now what we've done is we've actually translated that into the second trimester of their pregnancy, because then they're a little bit more calm in regards to where they are during their pregnancy, and the nutrition component comes into that. And I think not only is that important with what they're eating, but it's also important for post-pregnancy and what we do postpartum, and that healthy mindset, even when it comes to supplementation postpartum after breastfeeding.
I call this in marketing like a tripwire or a trigger. So it's like if this, then that. So it's if someone schedules, a new OB appointment, they get on, your calendar, or an alert gets flagged at let's just say maybe like the 14-week appointment or something like that. These are all things, and it doesn't have to just be in obstetrics and gynecology. We can make this in physical therapy. We can make this in chiropractic. We can make this with a cardiologist, and where it's a if this, then that, then there's a conversation that comes up. Then they get introduced to TLS Select. Then they get introduced to product. Then their account gets created. You can use what Kim is talking about as a model for really almost anything. To make that tripwire, to make that trigger where nutraMetrix comes into the conversation. And I like that you have adapted, Kim, like you used to do it first trimester. Now you're finding second trimester. This can be a moving target. I like what Dennis Frank says. He's, ready, fire, aim. Like, let's just do it and see what happens. And we can change this. You did not fail. Can I just also just brag on you for a second that you've had 5 babies and 4 pregnancies. So I think you're very much, yes, she had twins.
Yes.
She's cuckoo out of her mind. So she is absolutely well qualified to talk about this. And I'm sure.
I can always say you're preaching to the choir.
Yeah.
You're preaching to the choir.
I get it. Puking your brains out. I was there. Feel terrible. I was there. Oh, you got a little one also at home? Yeah, I did that. Yeah.
Mm-hmm. Done that.
Yeah. So that's great. So you're the NC in the clinic. Are you also your own NC, or do you have other people that kind of help keep you in check?
I have other people who also keep me in check. I always say with TLS specifically, and any of the clients that I work with or patients that I work with TLS, you, even as a coach, even as a NC, even as a practitioner, you need those accountabilities. You need that, you need those mentors to keep the momentum going, just as a checkpoint. So yes, I have several checkpoint mentors that I work with, including yourself, that keep me moving forward, keep my, eye on the prize, in a sense, that these are my goals. I need to constantly be changing what I practice to the better in order to obtain goals.
Okay, so let's talk about these goals, because you got some lofty retail goals, girlfriend, and you basically pour goals into a breakfast bowl and eat them every morning, I swear, and just crush them. You had your last quarter, when you got finished adding up and all the numbers, you did about $9,000 in retail sales yourself. Yes. WTF, break it down for us. How did this happen? Did you set out to crush it? Did you just know it was going to happen? Just pour on us here.
What I think of a few circumstances, our environmental circumstances most certainly play into that. But my philosophy has always been authenticity, being authentic, making sure that I'm talking to clients, even people that I haven't talked to or don't even purchase supplements from me, but creating the relationship of trust so that when there is a question, that they know where to go. Follow-up is my huge. It's something that I do. That's something that I eat for breakfast every morning. On Mondays and Tuesday mornings, I pull out my files and I start my call list. I just flip through my book. I look to see when the last time people ordered, when it's time for them to reorder, and I make that call before they have to make that call to me. And I think that is what changes the dynamic of my business, is creating those relationships, creating that trust. There was a patient that I haven't seen in at least 5 years now, who happened to see on my Facebook post, not about product, but about how I feel. And you may have seen it recently. I'm a big mountain climber, so I climbed a mountain. It was the 13th highest mountain in New York State, mostly boulders up creek beds that I was climbing. It was a great experience with my kids, but I shared that on Facebook, and you know, I did show a little bit of product because I said, thank God, thank heavens, I brought these two things with me, because the next morning I had no aches or pains. You know, no promises, but as a result of that, one of my 5 years ago clients saw that and called me and said, you know what, I'm coming into the practice on Thursday. Can we meet? Because I think you may be able to help me. It's creating relationships and trust that when people see those triggers, they know who to call. You always say, I got a guy. That's what we're creating. You know, I'm your guy.
Yeah. I always say that too. I'm like, I don't care if you pronounce my last name right or if you even remember me, but I want you to know that I'm the vitamin girl. Like, if that's what you remember me as. I love when I get group texts from my accounts or my customers, and they like put me in a text with someone else and they're like, I got Sarah. They always forget the H on my name. Sarah's here and she's your vitamin girl. Talk to her about your vitamins. And I'm like, no, you remember. Like, that's my absolute love language. So Kim, I didn't ask you to prepare this, but is your big book within prop distance? Like, do you have the book right there? You could just, you have this big binder.
You know what?
I put it in my local seminar.
If I can walk away for a minute, I will.
Do it. Because I love props. Props are the best.
And it's old, and I haven't changed it out. It is the same old book because it's my trusted book that I can literally flip through.
Kim, I knew it was going to be within reaching distance because what you focus on, you will grow. And I know you look at that book every single day that you're committed to building your business, every single day that you're committed to growing, which for you is every single day. And I know that you're not just committed for your own personal, but you also look at the retail of every single one of your business partners, because you know if you can link arms and create a chain and pull everyone along with you, that's going to be that leverage factor. And I know that you do that. And I get just goosebumps because I think of all the people that you're helping, and you love when you can have those calls. And like, I got to text a new business partner yesterday and say, hey, you hit your first $300 check. Like, did you notice? Did you see? And I know you love those calls too.
Awesome. It's awesome to create that really, and they may, those people that are with you, your partners, your tribe, when you're able to share that information, whether they realize it or not, or even attach numbers to that, when they hear that, when they hear the excitement of a senior partner or a partner in general, even if there's no financial connection, when they hear that information, sometimes that just, if they're having a bad day, that just switches that dial, and all of a sudden they're ready to put 100% in again, where it may have dropped down to that 70, 60%. And I think that's so important as far as team building tactics.
So huge. Kim, this has been really amazing. I appreciate you. I thank you so much. Is there anything else that you'd like to add?
The only thing I would really like to add is in a practice, if by chance no is the temporary answer, whether it be no to bring in a specific product, no to bring in TLS, any type of information, no is temporary. The dynamics of our environment is changing daily. And, you know, one of the things that we have changed as far as advertising in our practice is we are now a comprehensive practice, and comprehensive really enables everything to work together synergistically. And I think that is becoming more of a mindset in our communities now.
Yeah. Oh, can I just add to that too? No is not a no to you. It's just a no to like what you're saying. It has no value on your self-worth. It has no value on your skill set. It has no value, there's no correlation between anything personal. And it's so hard to take the no's and make them not be personal. But I think that's what, if you can just understand that it's as simple as when the waitress came over and said, you want dessert, and you didn't want dessert, or like you knew you had a chocolate chip cookie at home that you'd been, eyeing all day. It has nothing to do with the waitress. It has nothing to do with the restaurant. It's the same. It's the absolute same. Can we just get that into everyone and follow up? Still ask if they want dessert the next time. This is such a terrible example to give you as a TLS coach. I think I am the most awkward analogy maker in the entire world. So.
I will say, this morning I was with some of my mentors. We do a Friday morning coffee talk that one of our senior leaders heads, and it's very nice because she is always giving us wonderful inspiration, not necessarily driven towards nutraMetrix or any division, but just about sales in general, working as an entrepreneur in general. And one of those messages was no builds. Those no's build. And we've heard that in conferences. We've heard that from many of our senior leaders and leaders in general. But, no's are part of the process, and it's okay. You learn as you go, and no is not a personal attack at all.
Let's call her out, because that's the fabulous Mrs. Shannon Goodberry, right?
Yes, it is. Absolutely.
Yeah, it's so awesome. And you guys just have such a, you radiate, beauty and authenticity. And because that's, I always say, if you squeeze a lemon, what's inside of a lemon? It's going to be lemon juice. If you squeeze an orange, what's inside an orange? Orange juice. When we squeeze Kim Fenter, it's nothing but beauty and positivity. And, because that's what's inside of you. And so when you get poked and prodded, it's, it's a lot of the inner work. And you're right. And how you show up for not just the yeses, but how you show up for the no's, and how you show up for the not right nows. And that's you getting poked, and whatever's in the inside and whatever you think about you and your own self-worth is what's going to come out. And that's why, Kim, I think you show up, so beautifully and build so beautifully.
Thank you. Yeah. Thank you very much. You just made my day.
Come this way. What happened to us? Getting sappy on a Friday. Not even happy hour yet. So,
what is that?
Kim, thanks so much. And I hope people tag you in the Facebook group if they have any questions with this, and
please do.
Share this, because it's super inspirational. So
thank you, Sarah. Thank you. And you all have a great one. Thanks.